Hi, this is Savea Hirdler and Kelsey Jackson, and we did our community engagement health promotion project on nutrition in preschoolers.
So, preschool age children, and they're a part of low income families in the suburbs of Minnesota. They have a low nutrition status related to being low income, and they're from very diverse cultural backgrounds.
So some of the health determinants that play a role in this poor nutrition are low income, lack of education, underutilization of government services, and a low percentage of the population taking advantage of health services available to them. So these all interact, leading to poor nutrition. So the caregivers' education status, such as whether they graduate from high school or have any higher level education, that impacts their family socioeconomic status, which directly then affects the nutrition of that family. So individuals in this population are at high risk for poor nutrition because of their low incomes and knowledge deficit regarding government and healthcare services. So a lack of education in the caregiver or primary provider of that family and a knowledge deficit leads to low incomes, which then can lead to further knowledge deficit regarding healthcare. So people in poverty typically have a poor healthcare understanding of healthcare. This can also include health literacy as well. So having a knowledge deficit regarding healthcare then leads to poor use of services available. So the government services, some of the examples of those could be like a WIC clinic, which would be very helpful for a lot of people in this population. And then other health services like the public health department, counseling services, and nutritionists that might all be available through their public health department.
So, nutritional education should begin when the child is young to develop healthy habits for their whole life. They should be provided at a cognitively appropriate level for preschool children. So, in Baskel and Bahar's article, they did a study with Piaget's theory. So, preschoolers at the pre-operational stage, and so they did an educational program that was directed towards that stage. And they just use like bright colors and music and interactive games, and that will all improve when the child remembers food in the cafeteria. Discuss the potential long-term health effects of poor nutrition. This can be hard with preschool-age children just because they don't understand the long-term consequences of poor nutrition, but some of them would be like diabetes, obesity, or cardiovascular disease. You also want to provide activity for children to complete individually to assess their understanding. And what we did in our health promotion project was set the kids down individually and made them make a plate with us. So with everything like fruits and vegetables and grains, protein, and then dairy. And then we assessed them by how well they were able to put it together. And then you also want to encourage caregivers to voice their concerns and questions about nutrition. So one thing that can be done is in a survey, there should be a portion that is part of questions, so then that can be addressed in a nutritional program with the caregivers.
So obviously with this health promotion plan, we really want to invest in the lifelong health status of these preschool age children, and we're doing that by reducing the knowledge deficit and promoting nutrition in low income families by providing practical advice on healthy eating on a tight budget. So more than just telling them to eat healthy, we really want to give them some practical ways to do that. So this might include teaching parents about how to use coupons, or maybe some cheaper ways to find healthy foods like a farmer's market or something like that. And with kids as well, being able to give them some hands-on ways to understand nutrition like we did in our project with them. And so all of those practical ways will help this population reduce their knowledge deficit and start eating healthier diets in order to improve the health status of the preschool age children for the rest of their lives.
So to get the best benefits, you want to apply multiple different strategies. So classes on nutrition for caregivers, like we said, and then like addressing their questions that they may have that come up on the survey. Nutrition incorporated in a teacher's curriculum. So there's a lot of different ways that this can be done, and just like doing the interactive games and bright colors and the individual assessments can really impact the child's knowledge about nutrition and help them make better choices. Family events where each child brings a healthy dish that is common to their culture. This is something that Head Start's done in the past, and it had really great outcomes. And each family would just bring a healthy dish, and then they would also like wear their cultural dress. So you'll get many different dishes, and then many different cultures can be a really great environment. And then you also want to use interventions from the public health intervention group.
So to implement this health promotion plan, we need to work in collaboration, and there's many individuals and agencies that we can work with. So one of the main ones will be the Ramsey County Public Health Department. And so this population living in Ramsey County has access to this public health department, and a lot of services are available through them. And some of these examples I mentioned before, WIC is a big one for this population, having young kids and being in that poverty status. Families in this population that are will most likely be eligible for a WIC program. And so through WIC, they can then have access to nutritionists or a dietitian, whatever they have on staff, and then getting help with that food by purchasing it for them as well is going to be really key for this population. Other services through the public health department, there might be a free clinic. There may be just educational classes that they can attend, some home care visits if that's necessary, just a lot of services that would be available to this population to help assess and promote nutrition. Another agency that we have been working with is the Mounds View Head Start. This is where we've been doing our CE for the last couple years, and they've been really great about collaborating with us. And so not just as an agency, but there's a lot of individuals that go into this agency, and so they all can work with the children and with parents to really promote this, to promote good nutrition. So teachers are in contact with these kids every day, so they're a really good first line of defense in teaching about nutrition. And they can do that by incorporating it in curriculum, by setting good examples during meal times with them, and stuff like that. So also Mounds View Head Start provides meals for children in Head Start throughout the school day. So on a typical day, every Head Start student is receiving 2 meals during their time at school. So this is a really good way to just ensure that students are getting meals at least a couple times a day during the school week. And they can also work then to provide healthy food options, taking into consideration cultural considerations and allergies that children may have as well. So this way we really make sure that they're getting healthy foods and they're getting it twice a day. So we know that before sending them home that they're really getting a couple of good meals in. Minnesota state government is also huge in collaboration for this health promotion plan, mostly because of the funding that they provide. So public health departments can get grants through the state. Head Start also gets funding from the state as well. So this is a really just important to remember on like a systems level that we're getting a lot of funding comes from the state or federal government, and so to incorporate that as part of our collaboration.
So mechanisms for public involvement, nutritional status survey for the caregivers. So this is for family members regarding their current nutrition status, including their understanding of nutrition and some foods that they frequently buy. Also ways that they think that they can improve their family's nutrition. And then you, like I said earlier, you want to include an area for questions. This way those questions can be addressed at the classes for the caregivers. And then the family potluck event, so you want to incorporate healthy foods from many cultures. This way different cultures can get different ideas for healthy foods, and you can just see all of the different cultures and what their traditions are.
So the health outcome for this plan is to increase the understanding of nutrition for preschool-age children in families with low incomes, evidenced by having 80% of participants teach back the information provided. So rather than just giving this information, we really want to make sure that it's been understood, and then we'll start leading to some changes in nutrition in this population. So by our way of assessing this is by having the kids teach back the information provided, and this is kind of difficult in this age group because of where they are at developmentally, and so one way that we had decided to assess this their understanding is by, I think Kelsey mentioned it before, by having them put together a My Plate from myplate.gov, and to incorporate every food group within that, and talk about the healthy foods that are options within that. So our goal was to have 80% of participants be able to put together a complete plate, including all 5 of the food groups, and to understand, to then verbalize an understanding of that being a healthy meal or a healthy plate. If we were doing this with like the family or caregivers, teaching how they might teach back will look a little differently. We still want an 80% of the participants to be able to teach back the information, but it may be in small groups being able to teach each other the information that they've learned and have that facilitated by a nurse or one of the workers at Head Start to be able to kind of facilitate that and clear up any misconceptions.
So a summary of all this information, the feasibility of the population health plan. So resources are available through the Head Start programs like we had mentioned. There's a high employee interest and involvement, so the teachers love getting involved, love incorporating new things into their curriculum, so that is a very good strength. Some challenges though can be funding, whether that's like getting healthier meals at school and whatnot, and then also collaboration with families can be kind of difficult. They have other children and full-time jobs, so just like getting in contact with them can be kind of hard. There's cultural diversity, which I guess can be a challenge and a strength, since there's different diversities, different foods, can be hard to generalize. Involvement of children, since they have such a short attention span and, like we said earlier, an inability to see the consequences of poor nutrition, that can be hard to assess and to teach. So cultural considerations, events like the cultural potluck will incorporate foods and traditions from everyone's culture and encourage families to teach one another about their own culture, which helps build community. It also gives examples of different food choices for every culture, and which may be helpful for the people attending to learn what different carbs are, what different vegetables are. And then consideration of the assets of the community population group. So within the population's community, Head Start is an asset for implementing this healthcare plan, like the teachers' involvement, the cafeteria workers' involvement. The community is also widely diverse, so there's many ways to incorporate good nutrition. And then partnership and interprofessional collaboration. So by having events and classes where families can learn about nutrition and share their own knowledge builds trust and partnership within that community, and teachers using the education plan in their curriculum will build collaboration interprofessionally, like with healthcare providers and school nurses, nutritionists, and then obviously the teachers.
And here are our references. Thank you.